Hi, I'm Dr. Swapnaja Joshi. I'm a senior physiotherapist. I'm Masters in Physiotherapy in Musculoskeletal Conditions. I practice at Reliva Physiotherapy and Rehab. Today, I'm here to discuss about post-operative physiotherapy management. So when it comes to surgery and physiotherapy always go hand in hand. Most of the people think that physiotherapy is only required after major surgeries like replacement of your knee or your hip or like bypass surgeries. But even after smaller surgeries like appendix removal, which is appendicectomy, or uterus removal, which is hysterectomy, physiotherapy is equally important. It starts right at the moment you're out from the OT. Basically, the physiotherapist focuses on reducing the pain, improving the muscle strength, joint mobility, reducing the swelling. The physiotherapy treatment starts right in the hospital, and for certain cases, it is prolonged even after the patient is discharged. Yes, the scope of physiotherapy in orthosurgeries is way larger. It involves long-term treatment of physiotherapy for weeks or months. Now let me tell you something that's even more surprising. Have you ever heard of pre-op rehabilitation? Yes, it does exist. So what is pre-op rehabilitation? It's nothing but teaching and training the exercises to the patients before surgery. So it happens mostly in planned surgical procedures where the patient is taught few exercises pre-handedly. It helps for the patient's body to get well prepared for the surgery. Even it helps to reduce the stress, the surgery related anxiety that happens to the patient. It also helps to maintain and improve the muscle strength and joint mobility of the patient. It helps to reduce and prevent the post-op complications by teaching the exercises initially in the earlier phase. And it helps us physiotherapists to understand the goals of the patients and their outcomes so that we can design their post-op physiotherapy program and customize it according to the patient's need. So the success of the surgery happens with the procedure and the complete physiotherapy rehabilitation. So when it comes to post-op rehabilitation, what exactly is post-op rehabilitation and why it is important? Now, there are many complications that happen post-operatively like leg swelling, blood clots that happen in your lower limbs because of prolonged immobility. So exercises given to these patients prevent these complications. Also, it helps to improve your breathing capacity and lung capacity. It helps to strengthen the muscles, improve their flexibility. It helps to restore and maintain the joint mobility. Post-op rehabilitation program depends upon the healing stage of the patient, the type of surgery that the patient has undergone, and the goals of the patient. So it's basically divided into three phases. The first phase is the early phase. It starts right in the hospital. So the basic focus is to ensure the wound healing, to reduce the pain and inflammation and the swelling, to improve the breathing capacity of the lungs, to improve the joint mobility and muscle flexibility, and bed mobility is also taught here in this phase. The next phase is the intermediate phase. This phase starts once the patient is discharged from the hospital. Here, the main focus is on improving the muscle strength and joint mobility, reducing the residual pain which is left, and here care is taken so that the patient is again functionally independent at his or her home or work settings. So basically this phase, the intermediate phase, can be taken place at a clinical setting like OPDs, or a home visit can be arranged for the patient. The last phase is the final phase. This phase depends upon the goals of the patients. So for example, a patient may have a goal of running or trekking, or a simple goal like climbing stairs to the temple. And depending upon the requirements of the patients, the program of this phase is customized. So here different higher level activities and complex activities are taught and trained to the patient depending upon their goals. So it is very, very important for one to understand that these programs varies from patient to patient. They are different for different surgical procedures and the time duration also varies. Now that we have understood all the three phases, you must have come to know that the symptomatic relief, that is reduction of pain and swelling, happens mostly in the early phase. But for a complete rehabilitation of the patient, but to achieve and maintain the proper muscle strength and flexibility, it is very important to continue with phase 2 and 3. Thank you.